This is a short demonstration video to guide you in the use of a cane. So there are a couple different types of canes. This is just a standard cane, kind of one you would normally see. And then there's also something called a quad cane, which looks like this, and it has the 4 points, hence the word quad cane. Some different parts of the cane to know about, how to adjust it. So typically there is a certain button system or a twisting mechanism to make it longer or shorter depending on your height. And then same thing with the other cane. The ideal height for your cane is to go where the bend of the wrist is. So this one is just a little bit too high. So I'm going to lower it for her. And it looked about 2 notches. Try that, make sure you tighten it. And then I'm going to put it back down beside her side. And that's just about right. So you want the top of the cane to be at around the slight of the bend of the wrist. So that way when you walk, there's just a slight bend in your arm. It can be taller or shorter. It doesn't have to be exactly at the bend of the wrist. It's whatever's comfortable for you to walk. But that's just an ideal starting point. So why would you use each different type of cane? So a standard cane is pretty much to just provide support. So say you have a little bit instability and you're maybe a slight fall risk and you would feel more comfortable walking with a cane, using a standard point is a great starting point. However, there is the quad cane, and this provides more stability. So if you feel like you're a little bit more unstable walking, but you don't necessarily need a walker, nor do you want to use a walker, because it's maybe a little more inconvenient, you can use a quad cane to provide that more stability with the 4 points. So how do you know on the quad cane which side to put it on? It does have a swivel mechanism for left or right hand, whichever side you're needing. But if you look at it, there's a straight side and then there's kind of like the K part that comes out. The straight side is what would go against whatever side you have it on. Okay, so how do you know which side to put the cane on? Typically you're going to put it on your strong side. So if you have a strong versus weak side, you want to have it on that side. But if you don't, you can put it on whatever side feels comfortable. If you rather have it in your dominant hand, you can do that, or if you rather not, that's fine too. But for this purposes, I'm going to act as if I have a strong side, which is going to be my left side. Put the cane on your strong side to provide more stability and a wider base of support when you walk. So when you go to walk forward, you're going to step first with your strong leg and do not move the cane. And then when you go to take the next step forward with your weaker side, the cane will go with you and the weak side together. Okay, so to walk up the stairs with the cane, you're going to get close to the step, and then you're going to take your strong leg, which is my left, if you have a strong leg, and you're going to step first with the strong leg, and then for the next step, you're going to lift up the cane and step with your weak leg. Okay. So to step down, you're going to again step down with your strong, and then place the cane down with your weak leg, and continue on to the next step. And you can also, to help you with your stability, to have your other hand on a handrail while you're walking up the steps. This video is not all-encompassing, so if you have any questions, please be sure to ask your physician.